Welcome. I'm Dr. Kristen Eckstrand, a fourth-year medical student at the Vanderbilt University School of Medicine and the co-director of the Vanderbilt Program for LGBTI Health. I'm here today with Dr. Jennifer Potter, Associate Professor of Medicine at Harvard Medical School, Director of the Women's Health Center at Beth Israel Deaconess Medical Center, and Director of the Women's Health Program at Fenway Health. Dr. Potter, so we're talking today about LGBT health, and I'm wondering if you can explain to us how are resilience and coping important for LGBT individuals across the lifespan?
Absolutely. LGBT individuals experience more violence and harassment and childhood sexual abuse and other traumas across the lifespan, and so they develop emotional and behavioral responses in response to the trauma to try to mitigate the effects of the trauma. And these might include responses that over the course of their lives are very adaptive and associated with resiliency, such as connection with other people, other support people in their lives, and development of greater and greater self-acceptance as time goes by. On the other hand, some of the coping strategies, if they have to do with substance use, problem drinking, compulsive overeating, unsafe sexual behavior, social isolation, things like that, may contribute toward unhealthy health outcomes.
And for clinicians, are there different screening tools or questions that can be used to evaluate LGBT resilience and coping across the lifespan? Absolutely.
Just as one would want to assess coping skills of any patient, one wants to do this with LGBT individuals in particular. And there are a variety of assessment tools and question sets that have been developed for this purpose, many of which have been validated with LGBT populations as well. And they would include things like screening for depression or anxiety or PTSD, post-traumatic stress, or drug and alcohol problems and things of that nature, using resources like the PHQ-9 or PTSD screener that's been used repeatedly, a screener for generalized anxiety disorder, that sort of thing. In addition, I think it's really important to include, when you're working with an LGBT individual, some specific questions about sexual and minority stress.
Can you explain a little bit more about sexual and minority stress?
Sure. So because of the accumulated traumas that happen over the course of many individuals who are sexual or gender minorities, it's important to really specifically ask about experiences in that realm. So one might ask something like, have you ever been bullied on account of your sexual orientation or gender identity? Or to assess how safe the person feels in the moment by asking them about whether there are any situations in which they would like to hide these aspects of themselves because they fear some kind of retribution or stigma or bias.
And once a patient discloses to you that they identify as part of the LGBT community and you ask these questions, what strategies can be used to foster resilience and development of healthy coping strategies?
There are a number of things, because a lot of people either are socially isolated because of their fears or maybe using substances as a means of dissociating from the unpleasant feelings, the intolerable feelings that have developed because of all these accumulated traumas. It's very important to try to help the person engage socially more and more over time, and hopefully in settings which are not prone to engaging around more of these substances in particular, or engaging around unsafe sex in situations where a lot of club drugs are being used, for example. So it would involve finding out who exists currently in a person's social system and trying to help them gradually develop relationships with other individuals and groups which have sober spaces and other things like that.
And so that last point, I think, is very important. So an individual who discloses a maladaptive coping strategy to you, what evidence-based strategies are out there to actually reduce harm in someone who has used the patient-provider space to disclose something that is that sensitive?
Right. There are a number of things that can be helpful. I think that one of the mistakes that one can sometimes make is jumping right away in the instance of drug addiction, let's say, as an example, jumping right away toward a goal of abstinence at one end of the spectrum. And I think that it's really important to remember that that may not at all be where someone is, particularly if the use of that substance is helping them to feel more comfortable in any social environment. And so in that situation, really trying to understand with the patient what it is that the use of the drugs or alcohol are doing for them in the social setting, and finding out what it is that they might be willing to consider doing to reduce the harm of such use can be a really valuable approach.
And in addition to that, are there any other questions or ways you might phrase some non-judgmental responses to someone who has disclosed a maladaptive coping strategy?
Absolutely. Because of the traumas, again, that LGBT people have experienced, even including traumas in the healthcare setting with people who are not accepting and may have reactions to identity issues and orientation issues, but also to disclosure of drug use, alcohol use, compulsive overeating, whatever the issue is that may have become maladaptive in terms of coping over time. I think that it's incredibly important to validate the fact that someone is disclosing to you. So really taking the time to sort of sit in the moment and say to the person, I'm so glad you're here. I'm so glad you shared this with me. I really want to support you with this, things like that, and just sort of sitting with that so that the person feels that they've done a positive thing for themselves in having shared this, as opposed to caused a reaction in you that's going to make you push them away yet again.
And that last point, I think, is also very salient. Is it helpful for individuals who identify as LGBT when receiving treatment to be in a treatment program that is LGBT focused? Is there an evidence base for those types of treatments?
Definitely. It's been shown that LGBT people have an easier time engaging in treatment when it's in a supportive setting, and also that relapse is prevented to a large degree when they're having ongoing care in a setting like that. And part of the reason for that is that the vulnerabilities of the person will tend to emerge during recovery. And all these vulnerabilities may have a whole lot to do with their gender identity and sexual orientation. So if there isn't a space to create more self-acceptance and work against one's own internalized homo or transphobia, it may be that the person is just going to be pretty much driven back to using the substance again in order to deal with their feelings.
And is there an example of a program that you can identify that does work like this?
Sure. There are several. Actually, we've been talking mostly about addiction-type programs, and a number of professional organizations of social workers, alcohol, substance abuse counselors, and folks like that have LGBT-specific addiction recovery, which is really built on a model of affirmation, validation, support, forming a group of people which may actually be a new social set for a person who previously has only been engaging in social activities with other people who are users, but now they have a whole new social set of people who not only understand their sexual orientation and gender identity, but who also can understand what they're grappling with in terms of their addiction. And I would also add that this is not only germane in the area of addiction management. I can think of another example right off the top of my mind that has to do with support for people who are undergoing cancer treatment, cancer survivors. And in that setting, it may be very helpful for an LGBT person to be in an LGBT-specific support group, just because, again, it's about vulnerability, and there may be issues that are coming up around sexuality and difficulties with sexual function as a result of the cancer treatments that people who are LGBT may not feel comfortable sharing in a mixed group with heterosexual people.
And when we think about, again, some of these maladaptive coping strategies, the reason why we treat them is ultimately because of the downstream negative health outcomes. So when we talk about health promotion, what health promotion strategies can we use to be tailored to LGBT health?
Right, that's a really important thing to do because many of these really need to be community-based. And one thing that I think is really helpful for vaccines, for example, is an opt-out strategy. So many LGBT people may not necessarily think that they are susceptible to certain diseases. A good example would be recent research showing that young lesbians do not think that they're susceptible to HPV acquisition. So they may not think that they need an HPV vaccine, and unfortunately, providers who are not knowledgeable may propagate the same theory. And a good example of that is providers who tell lesbians that they don't need a pap test because they're not at risk for developing cervical cancer. So I think that opt-out strategies for vaccines where they're available for the prevention of disease are really important. And in terms of screening for diseases like cervical cancer, the value of a provider recommendation really can't be understated.
And how should these messages, again, the opt-out strategy is one, but is there any other way we can tailor these messages to be culturally relevant to different groups within the LGBT community?
Definitely. I think a good example of a tailored health message would be working with people around overweight status. And in the heterosexual world, some of the messaging has to do with looking thin and being attractive to men in that case. And for lesbians, it's been shown that that isn't really a very effective message at all. And what's much more effective is to focus the message around health, longevity, quality of life, those kinds of things, and to really work from there.
So you've provided a lot of really wonderful information that a lot of people, I think, would want to know. You've had a phenomenal career in this. How can we work on getting some of this information into medical schools?
I think that there are a lot of opportunities to do that may actually not be all that difficult. One would be to remember to, when giving just a lecture type format presentation, to include examples such as the ones that we've been talking about that can be interspersed with other examples that work well in the heterosexual world. And these would be easily intercalated into a lecture series such as topics like social determinants of health topics or a preventive medicine course or something like that. But we do always have to remember as medical educators that people learn when they're the most actively engaged. And so learning strategies that involve an opportunity to actually interact with patients who identify as LGBT are going to be the most powerful in changing or potentially changing a student's attitudes. However, we have to balance that need with the fact that we don't want to potentially cause harm to LGBT individuals by perpetually asking them over and over again to educate us and potentially sort of putting them in a fishbowl. So some of the things that educators have done around this is to invite people in from a speakers bureau who are volunteering to be in that capacity, or to have a panel of LGBT people who come to a large class, and there's opportunity to hear from each person as in any panel, but also to maybe ask questions that one has on a more personal note. And then there are increasing resources available where LGBT people are telling their personal stories on videotape, which is not quite the same as having an in-person interaction, but at least you get to hear the person's own voice, which I think can be really important. And then finally, there are opportunities to either simulate an interaction with a person posing as an LGBT patient using standardized patient cases, or even role plays with a student peer, which will give people on either side of the role play an opportunity to experience what it's like to ask unfamiliar questions that make you feel sort of uncomfortable at first and kind of deal with that internal reaction, and then also to pose as the patient and maybe have a little bit of the experience of what it feels like to maybe be the recipient of a misstep in the interview of your peer partner. So I think that's a good example of a number of things. And then finally, I think that the opportunity to utilize interprofessional learning or to do a quality improvement type of project and involve students in that is really great. So one might do something like use a real-time misstep that's happened in an office or a ward environment and involve the students in a team fashion in solving how to have that not occur again.
Dr. Potter, thank you very much for being with us today.
You're welcome.